Ahora sí.
So hello everybody. Welcome back. First and all, I would like to invite you for this weekend. We have the fifth
Fifth.
fifth online live course. So now I have my colleague, Dr. Juan Manuel Alcivar, also. He's speaking English now, so that's very nice, you
Hello,
know.
everybody.
And I have also my fellow Elaine from Arkansas. So today we want to show you a new technology that is coming available in many countries. So we have a patient of a
41.
female of 41 years old with history of caustic stenosis post cholecystectomy. So how to deal in these cases? So you have a lot of different kind of alternative. It means you can use plastic stents. You can use uh,
Costa Magna.
Costa Magna treatment. It means goes and delayed and put more and more stents. More recently is to use also metallic
Fully
stent,
covered
fully
stent.
covered. There are still some risks of migration. You can use also partially covered, but you need to retire this kind of a stand before 3 months. I believe in 2 months, because the risk of
Grow.
the grow in tissue in growth is very high, so it's not recommended. But now we have a new technology from this company. This is AMG company. I think it's Medtronic is working with this company. This is the stand. So we will show you how to use the Unity B stand. This is a metallic stand that is biodegradable stand. So the time for biodegradation is from 3 to 6 months.
6 months.
This is very important to understand. Needs to be used under 0.035
Guy wire.
guide wire, and the balloon dilation that is already inside the stand is
10 millimeters.
until 10 millimeters of diameter. So the length of the stand is 60
Six.
millimeter, and the idea is to show you how to use it. We will have more cases this weekend, but this is the first one of the first cases in Latin America using this biodegradable stand. So this is the this is an excellent case to show how to treat with a biodegradable stand, and what are the advantage to use that is that we can avoid to use to perform a new ERCP after 3 or 6 months, and the metallic force can help you to to treat very well the stenosis. So there are a lot of details that are very important before to use. Is that we need to avoid to flush desinfect balloon when we are loading the stent. So the stent is already preloaded with the balloon inside, so you need just to pass. And one important trick is that it's better to avoid to use the elevator, because you can deliver accidentally the stent. So we don't need to let the stent outside. And the other important thing or interesting thing is that we don't need also to be worried regarding going to the left or to the right, the hepatic, intrahepatic bile duct, because this is an uncovered stent.
Un rato. Un rato. Un
¿Podemos
rato.
mostrar el stent acá?
Sí.
So this is the Unity B. you can see here, this is the stand. The stand is already preloaded. So
Este es como lo de las prótesis. Ganas de trabajo.
so we will pass the stand. It comes like a normal stand, you can see here, but this is for insufflation to perform the dilation. Okay, and you have also remark here that this is a 10 millimeter for 6 centimeter of length. So we will have very nice experts panel, international experts panel. We will have a lot of artificial intelligence this weekend, and I would like to invite you to stay with us. Ooh, the guy wire is going out. Wait. Say. Okay, I need to pass the guy wire again. Wait. I'm sorry. I was talking too much. So,
Es un esfínter.
okay, give me
Un
the balloon.
esfínter.
Sí, esfínter. So I will pass the guy wire again. So I was talking that this is a perfect case for this kind of situation. So we cannot, let's say, worry regarding the situation of the biliary tract because this is an uncovered stent. So the biodegradation you can follow up, and you need just to evaluate not by by a new ERCP. You need to evaluate using MRI. Okay, so now we are in position. I need to be very close of the papilla. Okay, because when the unit TB pass, we need to avoid to use the elevator. You cannot use the elevator. You cannot flush the guide wire with the saline or because this can deploy the stand. So we need to take a little bit of careful when we are manipulating this metallic stand. So I was talking about this weekend. So we will have a lot of new technologies. We will show you the discovery artificial intelligence in colonoscopy. We will show you also the cat eye. This is from Fuji, discovered from Pentax Medical. So we will have more cases for biodegradable stents and their uses. And we will use we will have a lot of therapeutic cases with new tools for therapeutic endoscopy. And finally, we will have also some cases with artificial intelligence for endoscopic ultrasound and biliary tract. So So I invite you to be with us, to join us, and to see all the cases that we will have during the live demonstration. We will have very nice international experts, and well, un momento. So discussing the cases with us, and also doing some lectures during the live transmission. So please don't. Cuidado, la guía no la veo. No, no, la guía sí. No, no la puedo tener con la uña. No, no se puede tener con la uña. Préstame el finteroto. So you need to avoid to use the elevator. So that's why my technician is not good today. The fall is his fault. Huh? I'm so sorry. No se puede usar la uña, ¿me entiendes? Tú no hagas nada, solo ten la guía. I'm sorry, I'm talking in Spanish to my technician. He's a little bit non-expert with this stand, so it's normal. Empuja la guía. Empuja la guía. Ok, perfecto. Empuja. So normally, as my good friend Michel Cajales said, you lose the guide wire again. I have to say that to my technician. Well, it's okay. So it's very important to avoid to use the elevator, okay? That's why we had these problems today. Toma. So we need to use you need to avoid also to manipulate the stand with your hands. That's why we need to use a transparent how I can say tube introducer. So to avoid that. So this is a very interesting technology. I believe it's part of the future of that we can do it. So I invite to you because we will discuss with the expert panel from Europe, United States, and Asia. What will this? I believe this is a very interesting future for this kind of technology. Yeah, it passed easy. The problem is not that. The problem is the nurse and the technician. He cannot take it, and you need to be very close of the papilla to avoid to use the elevator. So I believe in the future this is not just for use in non-malignant stenosis, but probably malignant also. We need to evaluate that in the future. So because we use a lot of stents in this kind of situations, and there are patients that the survival is not more than 3 or 6 months, so probably this kind of stents could replace in the future the standard stents that we have. It will depend also of many factors as the cost. ¿Me das video, por favor? ¿Me das video, por favor? So I am here with the stent, I believe, because I feel it. Okay. So now, it's a little bit difficult, huh? But we are here. You see the stent? So, ahora sí ten. So now, my technician needs to. Now, you see, you need to be very close to the papilla.
Endoscopía Bolaños.
10. Okay, 10 ahí. And you need to use your ten. Cuidado, la guía, suelo. Dame una gasa. Okay. It's a little bit difficult to go up without the elevator. So I believe the stenosis is a little bit 10. Okay, so okay, maybe. I think the stenosis is a little bit tight than the stent. So I will do a dilation. Vamos a retirar. Voy a hacer una dilatación primero. So this stent is ¿cuánto mide?
5.7
It's
French.
5 French, 6 French.
6 French.
So what I will do is necesito el plástico. I will do is first to do a dilation because I will not pass. It's difficult to to use the elevator. Don't use the elevator. You don't have force. You need to take care. Okay, so the unit TV is okay. 10 10 Oh. Okay, 10, solo 10. Okay, no pasa nada. 10 ahí. Está bien. Okay. Déjalo ahí, no toques. Ok, retira. No, no manipules ahí. No manipules ahí.
La punta no. Al revés de ahí. Eso.
Okay. So I will do a balloon dilation.
6x4.
Sí. Perdí la guía. Con el balón lo subimos. Aquí. Toma. No, no, no.
Perdí la guía.
Toma. Pasar al revés. Ok.
Just short.
Saca. Ok. Ok. Empuja la guía. Empuja la guía. Okay, yes. So, I believe we need to delay it first. Okay, 10. Say. Okay, yes. It's a little bit difficult. Okay, let's go to do a dilation. Okay, desinfla.
Carlos.
Okay, desinfla de nuevo. So, I will do a second dilation here in this position. Okay, perfecto, gracias.